I just want to get deeper into this to discuss this for now. What does it all mean for the country? We are joined by Jacqueline Musomi, a researcher from the Southern Africa Labour and Development Research Unit, by Koketso Moeti, a gender activist and the founder of Amandla.mobi, and Daniela Casale, associate professor at Wits University School of Economics and Finance. Ladies, good morning, and thank you very much for your time here on eNCA for the next half hour. And so we're going to look at different angles. But just to kickstart this, my colleague Michael Merila has just referred to the research by NIDS CRAM, and Professor Daniela Casale, you are one of the authors who's involved with this research, and I understand that you've stressed that these are merely estimates at this stage and that they should be treated as tentative until you can get more data is revealed in subsequent research. Should we expect these numbers to be worse than what we are seeing now?
That's a good question. So I think the first thing to just stress is that even though these are estimates, they're probably the best estimates we have in South Africa at the moment, because we were able to interview a group of 7,000 individuals in South Africa, largely representative of the broader population. But we were only able to ask them questions about the first month of lockdown. So we really measured job in April. And between February and April, we saw this massive loss, as we mentioned, of 3 million jobs, of which women account for 2 million. The question of where this is worse, that's a tricky one. You know, it's possible that in that month of lockdown, people were relying on reserves, on savings, they were giving their workers paid leave on board, and that, you know, continuation of lockdown and the crisis will actually be seeing more job losses forward, this kind of run out. On the other hand, with the economy reopening, we might find some of those jobs are on. So I think it's something we want to track it, and we're hoping to run at least another 4 waves of this survey.
Okay, Professor, I need to cut you in there until your audio is not great. It's such a great pity that we can see you very well, but we can't hear you very clearly. We're going to try and dial you back. Maybe we'll have to put you on the phone, but I've got the other two panelists. While we try and sort out Professor Daniela Casale's audio, let's hear from, next up, from the activist. Can I speak to you next, Koketso? I mean, I'm just wondering, as a gender activist, I mean, these numbers should not be surprising, because, I mean, for years you've been tracking how well or not women are doing in the labor market and in society.
Absolutely not surprising, but I also just want to add another component to it, right? While women are losing paid labor, there can be no doubt that unpaid labor is increasing. We know already before, even when women are working, women are primary caregivers in a significant number of households in this country. We also do know that when it comes to the primary caregiving of children, Children's Institute found that women are the primary caregivers even when fathers are present. So given that in this period, you know, we have, during the lockdown, as people were not working, people have been at home. And I would be quite interested in the fact that, yes, paid labor, you know, it's been a bloodbath for women in that regard, but the impact on the unpaid labor aspect of it. So it's not that women are not working, right? It is merely there is a shift in how, you know, that labor is rewarded, that labor is compensated, if at all. Yeah, and I think that's something we should not lose sight of, because the impact of this as well is going to be quite far-reaching.
I think we'll get more sense. We'll discuss this unpaid labor scenario, as you said, which is worsening for women, which is increasing. Now, Jackie Musomi is labor analyst at the Southern African Labour and Development Research Unit. I mean, for years you've been looking at gender inequality, and now we are dealing with the latest NIDS CRAM survey, just focusing on the last few months from February to April. level. And the professor there, whom we are trying to get back online, and hopefully the audio will be better. We might not be able to see her. Just before we lost a connection to her, she made the point that they're going to do more surveys, Jackie, and that things might be worse.
Yes, Dan. So the thing with the South African labor market is that over time, we have seen the family composition change in that marital rates have gone down, and the households that are headed by females have gone up. And what you find in most of these households is that a majority of these female-headed households, it's single women heading these households, and they happen to be supporting more individuals who are under the age of 14. So these are individuals who are under the working age population. And so it's a compounding effect because so you have a family depending on a single employee who is a female who is suffering gender inequality in the labor market. So she is earning on average lower than her male counterpart, and she has to support more individuals in the household. So these are the challenges we are tackling with in South Africa. And what is happening now is that the occupations that women find themselves in happen to be in the services sector. So these are your elementary occupations, domestic work, occupations that require human interaction, and occupations that you cannot do from the comfort of your home. As you mentioned earlier, that from the Needs Cram survey, only 5% of professionals lost their jobs. Well, this is not by coincidence. Most professionals can work from home. You can work if you have a computer accessible to you, and if it's a job you can do from home, this you can. But what the challenge is for the women, and especially women at the lower part of the wage distribution, is that they need to be at their places of work, because women's work is very interpersonal, and that is why we are having those devastating numbers of women losing their jobs.
Yeah, and it doesn't bode well for the future. We will try and get into what we think should happen going forward. That we'll talk about that later. We've got Professor Daniela Casale back, but unfortunately we've lost the visual to her, but we've got a line. Prof, welcome back again. When we lost you earlier, you were saying that you are planning to do more survey. We are having this discussion because of your NIDS CREM survey. You are planning to do more, and things can get worse. Can you just very briefly recap on the key points you made, because the audio was not great a few minutes ago?
Right, can you hear me now?
I can hear you.
Fantastic. So, yeah, what I was saying earlier was that, it's very difficult to tell now whether things are going to get better or worse. It could go both ways. On the one hand, the economy is reopening, and so we may see some of those jobs coming back online. On the other hand, it may be that, we were only capturing what was happening in April with our first wave of the NIDS-CRAM survey. And in that first month of April, it could be that workers took paid leave, businesses used some of their cash reserves to try and keep workers employed. And when the money runs out, it's possible that things will get worse and more workers will be retrenched or be put on short time or lose their jobs or lose income from those jobs. So, it's really difficult to say now. But we hope another 4 waves of the NIDS-CRAM data coming online in the future, and we're hoping that we will be able to track this going forward.
Yeah, and the pandemic is still very much with us, as we know. We're still far away from a vaccine, as the scientists are telling us. But the women, in terms of your survey, Prof, whether it's in the formal economy or the informal economy, you found that they're worse affected.
Right. Now, that's a very good point. When we look at which women were most affected by the job losses, they were the women at the bottom end of the income distribution in February. So we found that, and it's a staggering statistic, almost half of women who were earning less than 1,650 Rand in February per month were without a job or job to return to in April. And I think that that's, really telling, because if you think about what are the kinds of jobs women do in those, in that income bracket, you're looking at women probably eking out, a living in the subsistence economy, maybe small-scale retail trade, agriculture. But you're probably also looking at casual workers, manual workers, think those in agriculture or domestic work who are maybe retrenched quite early on. So it's really those who can least afford to take the knock who've been hit by this crisis.
And just when you were offline there, Professor, we heard from Koketso, the other panelist with us this morning, saying that there's also a significant growth in unpaid labor. So you have women particularly who are doing work, all kinds of work, but not getting paid for it.
Correct. That's a very good point, and I'm glad, Dan, that Koketso raised that. So one thing we did measure in the mid-term survey was how much additional childcare people were doing during the April lockdown, when all schools were closed, ECD facilities, pretty much all childcare facilities. And we found that women were affected more by this additional childcare load. And that's not surprising, right? Because before the crisis hit, women were the primary caregivers to children in South Africa. And, that's for two reasons. And that's because women are more likely to live with children in South Africa than men are. But even if you take into account both men and women living with children, we find that women are still doing more of the extra childcare work. And of course, this has a number of implications for people's physical well-being, mental well-being, but also for their ability to get back into the paid labor market. Their ability to look for work, to work enough hours to earn a living, and to even work uninterrupted from home, obviously, if we think about those kind of in the upper brackets in the professional occupations. So, I think that the closure of schools, while I understand the rationale behind it, I think the closure of schools imposes another very big cost on society and women in particular.
And they are the ones who have to stay home and take care of kids and do homeschooling, and then they are losing out. And another very interesting point, Koketso, let me bring you in here, that this survey has found, is that even employers, when they have an opportunity to look at sharing the workload and the working hours under current circumstances, because companies are battling, women tend to be the ones who are disadvantaged, even in terms of the number of hours that they are in paid jobs, in the paid economy, in the paid employment scenario that they have to do. I mean, what would we ascribe that to? Is it purely to gender discrimination, you think? What is it?
Right. I think there's multiple reasons for it. Right.
No, hold on, Prof. I'm talking to Koketso. Sorry. Just stay on the line. Yes, Koketso?
I think there's definitely multiple reasons for it, right? There is the hardcore, there is a discrimination, deeply held beliefs that women should be home at particular hours and so on. But then there's also the other side, as you know, South Africa, bad gender violence, gender-based violence levels, our rates of women being killed are almost 5 times the global average and so on. And even before this crisis, women have lived with a burden of constant vigilance, right? So you think about the fact that if you think about the victims of an in-depth analysis of the victims of crime survey, found that a third of women feared going into open places and parks, and more than half of women, 54%, felt unsafe walking alone in the dark. So there's also that additional component to think about, right? Late night working, right? In a country with such poor public transport, what does it mean? Who does it disadvantage? So there's really structural reasons. There is the outright, kind of discrimination, but there are also very structural reasons added to it, right? Who can access transport at what time? Who can safely or more safely, for lack of a better word of saying it, be out? Who has a bigger fear of being out at particular times? What are the beliefs? What is the childcare system at home, right? If you are not at home at a particular hour and kids are coming back from school, who's supposed to care for them being? So I do think that there are multiple factors, that inform this. And there are very, very deep structural things around infrastructure, around safety and so on that can be done. But then there's also the workplace, our workplaces, accounting for these things. I remember we've seen things like, late night workers who work in restaurants. I don't know if you remember, but there were reports of certain workers who would sleep at train stations, right? Because it is too late to get public transport at home. And some of these places are not providing transport for their workers when they leave, which again, unfairly disadvantages women.
Okay, so you're raising a number of, as you said, structural issues. I mean, what is very clear as you're speaking there, and I mean, we know this, but it becomes very clear that COVID-19 has indeed exposed and magnified the whole fragile socio-economic structure in our country, particularly the way it affects our women. We will continue. Okay, so Jackie and Prof, who's on the telephone line now, Professor Daniel Kasalu, who's one of the authors of the survey that has made us have this discussion today, will continue shortly.